I am joined by Dr. Henry Anyimadu. He is an infectious disease consultant at the Hospital of Central Connecticut. Thank you for being with us as we approach the second phase of reopening.
Thank you for having me.
So what is your advice as people start to venture back out to gyms, indoor dining, maybe a Father's Day barbecue?
I think we all need to remember that the virus is still circulating out there in the community. And the only reason why our numbers are going down now is because of our collective effort at physical distancing, using enhanced hygiene techniques, and masking. We shouldn't let go of all these skills and techniques that we've learned over the past 4.5 months. We should reopen very carefully in a rational fashion and continue to interrupt the spread of this virus.
I know people don't want to wear the masks sometimes. Are they important out in the public? Like, what if you're going to a barbecue with people you know? Should you still be wearing a mask?
I think overall it's very important that we keep wearing masks in public spaces and in situations where we can't keep 6 feet from other people. There's a study that was published in the Lancet that showed that face masks decrease the risk of infection by about from 17.4% to 3.1%. So physical distancing is important. Wearing a mask is also important, and we should keep doing it.
What about our elderly loved ones? My mom's 75. Can we hug her again? And what advice do you have for the elderly who might want to venture out as well?
I think our elderly colleagues should be careful when they are going out. They should assess the risk and make sure that they are not exposing themselves to too many people. And again, I believe that we all owe it. We all have a responsibility to keep them safe, because we should all behave as though we have the virus, and we should be wearing masks around them. And especially if they have comorbidities, they should be very careful in venturing out there.
Can you hug them safely?
I think they can go out safely and wear a mask and go to the shop if they have to, but they have to be careful because, as I said, the virus is still out there.
So what about a family hug? Is that okay?
A family hug should be okay. I think it should be fine to hug your mom and your parents, because we've all been hunkering down for so long, and we need to be the social beings that we've always been.
I know that you want us to take good care because there is concern that if we don't, there could be a surge in cases. So thank you for sharing this information with our viewers.
Thank you for having me.